I'm making my guest's favorite drink,
You picked a mojito, Vesper Martini.
the House of Balloons cocktail.
Nice and crisp.
Join me and some of the world's greatest writers.
Multi-award-winning author of 5 novels.
Best-selling author of more than 20 books. The Pulitzer Prize among many other awards.
Welcome to Dedicated. I'm your host, Doug Brunt. Today we're with Dr. Marc Siegel. He is a clinical professor at NYU Medical Center and a practicing internist specializing in chronic conditions, things like diabetes and high blood pressure. He's also the senior medical analyst for Fox News Channel, a position he's had since 2008. And he is co-founder and director of Dr. Radio right here at SiriusXM. On top of all that, he's also a best-selling author. He's written books on swine flu, bird flu, COVID, and his latest is The Miracles Among Us: How God's Grace Plays a Role in Healing. It's an amazing read. It's got a nice foreword by the lovely Shannon Bream, and a terrific, fast-paced read that really sort of gets you in touch with faith and what's happening around us. So, Marc, welcome.
Great to see you again.
Now
we go back a long way.
We do, old friends as well. So, I mean, 20 years.
And a fan of your writing.
Oh, thank you very much. Thank you.
I remember reading one of your books on the plane to Moscow, for whatever that's worth. I was so engrossed in it, I lost my glasses on that plane flight and had to get another pair. But I have another pair coming this week, so maybe there's some miracle to that.
It's all coming full circle. Well, we're being good patients today and not having any liquor. We're going to have coffee as our drink today and stay on our toes. So cheers and great to see you. So I did, despite having known you all these years, I did learn a lot about you in my research. You're born in New York and then went to Brown undergrad. All right, so clearly smart, successful student as a youth.
You know, Brown taught me something, and my daughter just graduated from Brown, and I think she learned the same thing, which is you can do 2 things well in life. And you're an example of that, by the way. You can do 2 things well. So when I was at Brown, I studied creative writing. And I studied graduate creative writing. And I graduated thinking I'm just going to write novels. And then I started on a novel and I said, this is actually harder than I thought, mainly because you have to sit in one spot all day long and have no connection with the outside world. And it's interesting. I eventually became really, really close friends with the writer E.L. Doctorow, as you know. Edgar became my next-door neighbor, knew him very well.
You and I went to one of his book events for his last book, Andrew's Brain, years ago. Yeah.
That's right. And Edgar started as an editor. So he also understood that being in the world idea. But I learned it in reverse. I got so claustrophobic just writing that I thought I have to do something else. And Brown teaches you can do 2 things well. So I went back and took all these science courses and went to medical school, having already a background in writing. I think that that's the best way to do it if you want to be a writer and a doctor, because if you start off being a doctor gives you too big an ego. You think there's nothing I can't do. Well, but you can't communicate. A lot of doctors think they can communicate and they can't. I'm really glad I started as a writer and then became a doctor.
Yeah. You're also this very curious person. My father was a physician, and I've noticed, having met many of his friends and knowing doctors through other ways, in my view, there are 2 kinds of doctors. One type of person goes into the field because it's safe, it's prestigious, it's recession-proof, and it's sort of a locked-in, fairly safe career. The other kind of person who goes into it has a different mentality. They're these relentlessly curious intellectuals. My dad was one. And it's almost like a Da Vinci-like multidisciplinary approach where they read everything, they take on other pursuits. There's almost an entrepreneurial bent to them as well. You're clearly one of those kinds of doctors.
I think, but I still look at it in reverse. You know, it comes back down to an age-old debate. I'm not saying we're having it, but we're not having it. But like, people try to teach empathy in medical school. My attitude, you better have empathy before you go to medical school. People try to teach doctors to write. I don't think so. I think you have to know how to write before you go to medical school. I think the skills you learn in medical school are different. There's a contemporary of mine who believes the medical record is a form of short story. Now, that's no longer true for sure. No one thinks that now. But at the time when she thought that, it was debatable. I kind of saw what she was getting at, that a patient comes in and this person writes on them, then another person writes on them. When we had the old paper charts, you could say it's a form of a short story. But I kind of like to look at it as...
Like literally looking at the clipboard at the foot of their bed is a short story of the various doctors coming in and each writing a chapter.
from their particular vantage point, right? Their particular narrative. It's different. The renal narrative is different than the psychiatry narrative, for sure. But I think I had some sense of that before I went into medicine. So it was natural for me to gravitate back once I had the medical skills to how am I going to, now what am I going to do? I never really wanted to be a journalist. I wanted to be a creative writer. And I guess the struggle was figuring out the exact form. I only became a broadcast journalist because I felt like I didn't have time to go on book tours. So I was writing articles and books, but I thought, but I have young children. So I thought, I'm going to go on TV and sell books that way.
Was your first writing medical writing for journals and things like that, or creative writing?
The first book I published was a novel. It was published in 1998 by Simon & Schuster called Bellevue. And it's a hallucinatory book about what it's like to be sleepless in the era of HIV/AIDS, drawing blood from people in the middle of the night on 2 hours of sleep that are drug users. I had in there what I call a wheelchair philosopher. We don't know what country he's from. He's probably French. He's pontificating on life, sitting in his wheelchair. We don't even know what his diagnosis or his disease is. But my main character, who's an intern, keeps coming to him for a clearer vision than he's getting in the medical dogma world. And that's how I guess I came to look at life. My editor for that was Michael Korda. There's no better editor, I think, in history, possibly. And then I ended up working with Chuck Adams. And I've still, on the novel I'm working on now, I had been working with Chuck Adams. A dear friend just passed away. Really terrific editors, both of them. I've been very lucky. I've gotten to know Alice Mayu when she was alive. Tremendous editor for Simon & Schuster. You know many, many great editors. You have a great editor. But the world of literary fiction and literary nonfiction really always appealed to me.
Yeah. So you're, through the 90s, early 2000s, you're a practicing internist, which you remain, and moonlighting a little bit as a novelist. And then how did you get hooked up at Fox News?
Well, in post 9/11, I thought that there was an ore to be mined, an ORE to be mined. What was that? That I think the society got its psyche punctured. And we all felt like what was going to be next. We thought we were on sovereign land here. We had oceans protecting us. And suddenly 2 of our signature buildings are destroyed. And we thought, what's going to happen next? And everyone felt a rift of cold air. And then that was followed immediately by health scares. And I thought that was connected to 9/11. I thought the anthrax, the swine flu, the bird flu, the West Nile, the mad cow, all of these scares I felt were related to people saying, what's going to happen next? And so I started writing op-eds about that. I started writing op-eds about it's more fear here than anything else. I wrote in the Times, I wrote in the Washington Post, I wrote in the LA Times, I wrote in the Wall Street Journal, USA Today. Some of these relationships continued for years after that. I became a columnist for the LA Times, writing a column on whether TV and movies were medically accurate, called The Unreal World. But I stayed on this rift of fear, and I then wrote a book on fear that became somewhat of a bestseller, False Alarm, The Truth About the Epidemic of Fear. That was in 2005, and I got called on TV a lot to talk about, let's calm people. You know, here's what we heard, let's calm people. That was a time when TV wanted to calm people. It certainly doesn't want to. Now it doesn't.
Outrage derby.
Yeah, it's like, you know. So Fox came along because E.L. Doctorow said to me, you can't keep going on TV for free. You have to be paid. You have to be
you're leaving
paid.
Money on the table.
You have to be paid to be on TV. And I said, Edgar, I'm on TV to sell my work or to get known brand recognition so that I can sell books.
Yeah.
He said, but you're going to be paid for that too. So somebody showed a reel I had done to Roger Ailes, and he said, well, I don't want him on the Today Show anymore. I don't want him on Good Morning America. Let's hire him here. And that's when I started working at Fox 2008. E.L. Doctorow said, that's the one network I didn't want you to work for.
So you became exclusive to Fox in 2008. And then they put you on like a contributor contract or something like that.
Yeah,
and then there's been no gap in there. You're only Fox since 2008.
Yeah, but it's varied. My role has varied. I've done, depending on the year, more reporting, less reporting, out there with camera crews. You know, I've shown more flexibility. I'm very proud of this. You know, I became kind of assigned to the New York bureau for a while. I would go out and do stories, and then some of that's continued. You know, even recently, I interviewed RFK Jr. I interviewed Marty McCary. I interviewed. Jay Bhattacharya. I do these interviews, and they salt it. They kind of add spice to my commentary. I prefer it. I'd rather hear what someone else has to say about a topic than what I have to say. But if they ask me, I tell them what I think. But I research it.
Well, I'm going to ask you a few things coming up. But before that, when did Dr. Radio kick in then? That's early 2000s as well.
So Dr. Radio started around the same time as Fox, and it was completely independent. It was a coincidence. And Dr. Radio is kind of another side of the coin for me, because I was in charge of all of these hosts.
And so the audience knows, this is on SiriusXM channel 110, and you host it, much of it at least, out of NYU Langone here in the city?
Right. We have a studio there. Initially, I started off just supervising other hosts, but then I took on a show of my own during the pandemic called Dr. Radio Reports, because I felt we needed guidance during the pandemic. We were one of the 2 stations that was free, and we did a great job. And I brought on people from the Trump administration, health officials, and then everyone said, well, now when Biden's in, you're not going to get any guests. It turned out not to be true, largely due to Dave Gorab, I must say, who you know well, because Dave is one of those people, and he's an executive vice president here, who gets along with everyone. Yeah. We may know what his political stripes are, but he doesn't show them. So he got me connected to the Biden White House, and I started bringing on people from there, became friends with the Surgeon General, who I think is a phenomenal human being, became friends with David Kessler, who was in charge of Operation Warp Speed under Biden and the vaccines. I'm very pro-vaccine, and that's something that has sometimes, let's just say, sometimes I go against the current. Yeah.
Gorab, everyone loves Gorab, and it's not due to some crazy diplomatic skill that he navigates. He just is genuine. I mean, he's also that, but he genuinely is a good person, and you can tell. You just know he's a complete.
He loves you, Doug. He loves you.
No, it's mutual. He's awesome.
I think he likes Megan better, but
that's fairly commonplace. All right, so let's talk about some of your positions, because you do interview a lot, and you get other folks' positions out there. But you have written some books and made your own positions clear on a few things. One is you would like to see presidential health records be public, both for in office or candidates for the office. And I think you first came out with that under Biden, and you maintained that position under Trump. That's an important thing going forward.
I think that's something that's been historically unfair to the American people. And one of the problems with the American people is that we don't look at history enough. We look only at culture. We look at current events. And so people don't realize that Woodrow Wilson was suffering from the Spanish flu when he signed the Treaty of Versailles, that led to the punishing of Germany because he was completely psychotic, and so he lost his mojo, and so England and France had their way with Germany, and that led to the uprising, the rise of the Nazis. Yeah. So all of these things are things we can learn from. That's Wilson. Then there's FDR, that was probably chose Truman because he knew he was going to die in office a 4th term, and then there's Eisenhower with his heart attack. So there's Reagan that lost most of his blood when he was shot. Nobody knew any of that. Under Biden, because I had studied this and written a lot about it, I was one of the first to say, look, he had aneurysms clipped in 1988. What's that? He had a bleed. What's that? He had atrial fibrillation, which is an irregular heartbeat. That can lead to cognitive problems. What is that gait he has? I was questioning all of that at the same time when people were saying, he's fine. It's unfair to be questioning. But I feel it's always fair to be questioning.
Are there going to be consequences for his physician, who I think to date has just taken the fifth?
I don't know. I think there should be, because of some specific thing, which is that if you look at his yearly physicals, they always are neurologically fine, but they never include MRI reports. They don't include the kind of breadcrumbs that we as physicians would be looking for.
Yeah, or like he's got this advanced cancer that must have been around, detectable for years.
You have 2 choices there. Either they completely missed it, which is incompetent, or they knew and didn't tell anybody, which is
criminal.
Yeah, that's your choice.
Yeah. How about COVID? I know you wrote a book there. I actually haven't read that book, but did it come from Chinese lab?
Recently, and this is what makes you a great writer, recently I asked the technical guy over at Fox in the pods, I just was schmoozing with him, and he said, my girlfriend lives in Wuhan, and she's my partner, and I've been with her for 15 years. I said, so where did this come from? He says, Doc, let me show you some pictures of the wet market. It looks like Costco. Now look at the lab. And you see just these photos and you see this difference. You say, how could it have come from this wet market? It doesn't look like what they describe it as, some woolly. So I think it came from the lab. I think it's pretty clear it came from the lab because the lab was working on bat coronaviruses because the structures were similar because they were having leaks. Now, at some point, it went to the wet market. And I did a lot of work with Robert Redfield about this, the former CDC director. He had a lot of inside information. I'll tell you one little funny bit about that. We were writing an op-ed together for the Wall Street Journal, and I came upon something that surveillance showed that people from the lab had gone to local hospitals in summer of 2019. And he said, Mark, where did you get that? That was supposed to have been destroyed. I go, that was online. I found it online. He says, yeah, but it's been redacted. It was supposed to be top secret information. Wow. That's our information leak these days.
Yeah, it's a new world for that. One other, on that, did you ever see the movie Contagion with Matt Damon?
Of course.
Yeah, that was amazing. It came out in 2011, so it was years before any of this COVID stuff, and of course, then got popular again in the wake of COVID. Everybody was watching it, and it was amazing how it tracked to real events. They clearly did a ton of research with CDC and other organizations to find out what the playbook would be. I found it sort of eerie watching that movie.
I think that great fiction is tied in directly with what ends up happening to us. There's an old saying about that you're going to love. Gordon Lish, who you've probably heard of, he's in somewhat of a disrepute because he rewrote a lot of authors and he did a lot of way too heavy editing, including Raymond Carver, who's a great short story writer, but Lish did way too much editing, a lot of people think. I took classes with Lish, and I learned from him. I took classes with Philip Roth, also with my buddy Dr. O, also with Lish. But Lish's line about fiction, and he has many lines about fiction, but the one that's apropos to what you just said is, fiction is turning the world on a slight axis to get to a greater truth.
Oh, that's good. Yeah. I mean, that movie, it caught so many elements of it. I mean, right down to, that eerie thing I think comes at the end of the movie where they're sort of tracking the initial spread of the virus from, sort of patient zero as it goes through some restaurant into the airport, into the homes in another country.
And that's what can happen. And it may happen again.
Yeah.
I don't know how you feel about what's happening in the current healthcare system, Doug. I'd love to hear it because I've been pretty vocal about it. I mean, I'm in touch with I hear from Kennedy twice a week. I'm not at odds with anybody, but my opinion is that we're way more vulnerable than we should be.
Well, that was another question I had for you. On balance, is MAHA a force for good or not?
Well, on balance, it's a force for good because it's saying before we get to the drugs, how about we exercise? Maybe we won't need the drugs. I was talking about that today regarding post-traumatic stress disorder in my book. There's a chapter in here about a veteran who heals through faith and reaching out to other veterans and joining Team Rubicon and joining the Veterans Wellness Alliance and the Warrior Wellness Alliance and mountain biking. And I met him on a mountain bike ride, but he came so close to suicide. And then he had a visitation from another vet that became his best friend, and it had pushed him to do all this outreach. The visitation came right when he was putting a gun in his mouth, and it stopped him. And then from there, he healed. But all of this was without medication. So at the same period of time, we're studying the impact of psychedelic drugs on post-traumatic stress in veterans. But my point would be, I'm more in favor of starting with exercise, faith, diet, love, hugs, outpatient. I mean, not outpatient, but connectivity versus medication. So that I like MAHA for that. And Kennedy is a deeply spiritual guy. He's a religious guy.
That actually gets back a little bit to the clipboard short story thing we were talking about in the beginning, where a different physician comes in and writes a different chapter. So you've got the heart specialist and the kidney specialist and the brain specialist. And if something's going wrong with the kidney, they give you a pill for it. Something's going wrong with that thing, they give you a different pill for it. By the end, you're taking 15 different pills to treat all these different end symptoms, when maybe the answer is lose 30 pounds and eat a little better, and all of these things go away, and you're not on 15 different medications.
And that's absolutely the way we should look at it. And I've written about the fact that we're a sick care system, because look at all the people profiting off of that. People, in other words, people are profiting off of people that don't look like Doug Brunt, that maybe, are. It's easy to swoop in and say, look, you need this pill, you need this surgery, you need this test. But that makes a lot of people money, and it doesn't necessarily make people healthier. Mm-hmm. It is good that we have the pills that keep you alive and that keep you with a lower blood pressure, but so does exercise. By
the way, I do have high blood pressure, and I'm resisting taking the pill. I'm trying to exercise a little bit more. And along those lines, actually, do you ever we're not drinking today, but do you ever drink or no?
Of course. I like wine.
Okay.
Do you?
All right. I do. I like wine, and I'm trying to limit drinks to like 4 a week. My doc, you probably say the same. The doctor's like, it actually is a poison. It's kind of a little bit better if you don't do that. But I think a limited amount seems to be okay. 4 or 5 a week, is that good?
Well, I know you pretty well, and I'd say for you it's probably okay, but it's not okay for everyone.
That's too much for
some people. Yeah, it depends on their a lot of things. I think, but none is better. A couple of glasses of wine a week, 3 is probably fine. 3 a day, no good.
All right. Okay, I think I can manage that. All right, let's turn to the book for a minute. The Miracles Among Us. It is great. So it's a series of vignettes, really. I don't know how you're describing it, and some were near and dear to my heart. We know Brett Baer and his wife Amy and their son Paul. So the audience knows it's The Miracles Among Us. There are a series of stories in which you can really feel the hand of God coming down and making things sort of work out for the best in a very dicey situation.
Since I've written the book, I've started to call it the miracle lane, what you just described, the miracle lane. You're in a miracle lane, because my publisher and I, Lisa Sharkey at Harper, who's phenomenal, talk about creative geniuses, just exuding genius, like your wife, a similar type of personality. And you in fact, Lisa, because she published Megan's book. Mm-hmm. But she says to me, Lisa, what's the miracle in each chapter? And my answer was always, no. It's not one miracle. Now, I think it's an accumulation of miracles that know you're in the miracle lane. Here's an example. And this chapter I'm about to tell you about, both major characters in it say, I don't want this to be known as a miracle because of the people who didn't make it. It's a dishonor of them to say that our survival is a miracle. And these are the two main characters in the chapter on October 7th, 2023 that I did, where their house was burned down by Hamas. They were stuck inside with a tiny baby, 9 months old, where they managed to climb out the window eventually after protecting the baby and themselves with a mattress. They climbed out the window completely negative, covered with burns. Completely naked, covered with burns. And they made it to a tractor and hid above the tractor from Hamas, all the while picking up fungi on their feet and infections and burns. And finally, they made it to the front of the kibbutz, and they got airlifted to Sheba Medical Center. And the woman, Ilay, was a physician. She was an anesthesiologist, and she was training at Soroka Medical Center, but she ended up in Sheba. And at the end of this story, Sheba wanted to keep her. Finish your residency here. You're a hero. She says, no, I'm going back to Soroka. But what happened to her in the hospital is she was in a coma for a month. She had blood clots. She had inhalation burns. She had fungal infections. She had bacterial infections. She had COVID. The whole family had COVID. And she was taken care of by an angel, a literal angel named Yael, the same as her daughter's name, who had taken care of and saved all these COVID patients during the pandemic. The biggest thing that happened differently than you might expect is a drug called Nexabrid, which Israel now has, made from pineapples in China, that you used on burns so that you don't have to use scalpels. And it burns you right down to viable tissue. It saved their lives. So
Like
Lisa,
the acidic content of the pineapple burns away the...
well, they modify it into a chemical that it becomes an ointment. And it's now available in the United States, but barely. And Israel has because they have so much trauma there, they've made a hero out of this cream. And Lisa says, that's the miracle, the cream. I go, well, what about all the other things in this chapter that I told you about? They made it out of the burning house. Oh, she breastfed her baby. That was the only way she could keep the baby alive, was to breastfeed the baby over this tractor. There's so many miracles in this chapter.
Yeah. The other one, the Steve Scalise story, which I knew 20% of that story, having followed some politics in the time that occurred, you had so much more in there. So you've done incredible in-depth reporting here with interviews with all the subjects, including Scalise and the other folks that were there at that shooting. So the audience knows that softball game where a shooter came and shot Scalise, and I guess others were shot, but he was the most seriously injured. And I didn't realize even he was in a coma for 3 days.
And that's the key, is to take your information from various angles and see if they agree. With Scalise, the miracle here was actually the combination of the surgeon, who was phenomenal, and the invasive radiologist, Dr. Khan, who actually was able to burn off parts of the iliac artery that had ruptured so that they weren't a problem, and then the rest could be sewed up together. He would have bled to death. He got 50 units of blood. His blood pressure was close to 0 when he came in, but because this radiologist says, I never worked with clamps coming out of somebody's belly before, and not even in the OR, in interventional radiology. Sweet. That's where the miracle was. When somebody says, we never had that before, and we don't know how the patient survived. And he survived from faith and courage and never giving up, the presence of God. All of that played a role, as well as these doctors. And that's what Cardinal Dolan said to me that really motivated this book. He said, yes, there's the Catholic Church miracles, which can't be explained in any other way besides divine intervention. But there's also the daily miracles that I call soft miracles, he said, where it's a combination of great doctoring as well as the hands of God.
Yeah. Yeah, the soft miracle line from Cardinal Dolan is interesting, and it gets to that idea that God works through the hands of these surgeons, and it's got to be incredibly heady for any person to have the knowledge and skill to save a life. And it reminds me of that Alec Baldwin movie called Malice. Yeah, I don't know if you know that one, but
love that one.
It gets to he's kind of doing a whole ruse there, but someone says, you have a God complex, and he's like, you asked me to have a God, I am God. He can give life through that. It's such a crazy a skill to possess for a person. You saw the Alec Baldwin movie I'm talking about,
where he plays the evil doctor, right?
Yeah, yeah.
I used to be a big Alec Baldwin fan, and he lives in Sag Harbor. But lately, with everything that's happened, I'm less motivated.
Yeah.
I don't know anything. Look, I'm probably like you. You meet people in real life that other people only see on the screen. I never have an opinion on someone I don't meet in real life. Mm-hmm. When I met President Bush, and he's in this book, he's a totally different personality than you might expect, or that you were told. The media's told you he was dumb. In person, he's a genius. So people in real life are not what you're expecting.
No,
President Trump, totally different than you expect. I interviewed him in the White House. He's like making a joke every minute. Mm-hmm. He's a very funny guy and warm guy.
No, when that's what's good about the book too. It's all primary research. You can't read what's in page 6 and think that's actually who people are. One last story from the book that I wanted to touch on, the Brett Baer, Paul Baer, Amy Baer story was really heart-wrenching. I know the Baers a bit, and there was so much more in what you have here. And it was, so Paul Baer, the son of Brett and Amy, was born with a congenital heart problem. And he's now in his late teens, and he's had innumerable surgeries. And one of the interesting arcs of the story is that his awareness of the situation evolves as he gets older. When you're 2 years old, you're just going in for a surgery. Now he's sort of taken the reins of it himself, and he knows he needs another life-saving surgery, and he says, let's do it. Like he's aware of the risks, he's aware of his circumstances, and now has a totally different level of ownership of it, I guess.
Doug, this shows you're a great writer, because I actually wrote that chapter thinking you were going to ask me a different angle, which is it's one of the chapters that strikes me as medical, because I go over all the medical details of it. But you pointed out something I hadn't even thought of, the arc of Paul's awareness. That reminds me when I said to E.L. Doctorow gave me the Waterworks to read before one was a manuscript, which is a great honor for a writer of his ilk. And I said to him, did you realize, did you name the main character Noah because underneath the library is actually the reservoir? He said, that's completely in my unconscious. I didn't realize I was doing that, he said, Dr. O said. And here, you pointed out something that I'm so glad is in there, but I wasn't focusing on that. I was focusing more on the fact that he has to have these revised surgeries because he outgrows the cadaverous parts that are used, and that he has great courage. And I also was focused on the great love of Amy, his mother, and the differential that Brett presents between how he is he responds to the great threat with obsessive detail, like he is as a newsman. That's how he is as a newsman every single day. That's him. I want to know every detail. Amy just showing love and kindness and bonding with her child fearlessly to the point where she ends up in the hospital too because she blacks out. I love that combination. I love the sense of their marriage as a safety net for Paul as he grew older. And then, of course, where they end up playing golf together, Brett and Paul, the day before the last operation.
Yeah. And also some of the friends they made along the way, that it was Maggie's, is that right? The parents who lost their child.
That's so sad.
But stayed in touch with Brett and Amy and still follow up on Paul, and that was a very emotional part of the chapter.
But you're right about Paul. And now Paul is what he cares about, and what Brett cares about is that Paul has a normal life, not that he's not under media scrutiny, that he gets to live a normal late adolescence, early adulthood.
Yeah. Yeah. Well, it's a great book. It's very inspiring too, and there are many more stories in the book. A total of 19 or so.
And then there's stories within stories, and then there are stories that made the cutting room floor. You want to hear a couple of quick ones?
Yeah.
Okay, so here's my favorite that didn't get in the book because the publisher thought it was too risque, but you'll love it, which is that I have a patient named Todd, and Todd works for a nonprofit for homeless people. Tell Megan this story. She'll love it. Nonprofit, and he can't afford that much, but he has a Rolex that he loves. It's his prized possession. Well, one day, his wife, who's beautiful, gorgeous woman, in her mid-40s, says, I don't like my body image anymore. I need to have breast implants done. And the husband says, I can't afford that. So he loves her so much that he gets so sad over this that he goes and sells his Rolex, and he pays for her breast implants, and he buys himself an Apple Watch. One night, the Apple Watch goes off. He's in atrial fibrillation, a rapid heart rate. He would have died, but he goes to the ER. They cardiovert him, or they do an ablation, get him back to normal rhythm. And he says to me, my wife's breast implants saved my life.
It's a miracle of sorts. I mean, maybe that can go in the book club version or
Exactly.
All right, last question before we get into the lightning round. What is next? You've got so much going on with the TV, the radio, the books.
Well, as you know, I'm working on a novel, and I'm in the process of revising it and getting rid of all the COVID parts of it because they're out of date. But the novel is about something that occurs in the 18th century, where the beginnings of vampirism, or not the beginnings of, but where vampirism is believed to have been found in Eastern Europe. But that's odd because vampire bats are not in Eastern Europe. So how did they get there? They're actually in South America. How did vampire bats get to Eastern Europe? What is it they're doing? Is this really vampirism, or is it rabies? And that's something that's been the subject to neurological debate. And then if you bring it forward to this century, what do people do to that virus? If it is a virus that could put us all at risk, again, our vulnerability to the next pandemic. And I keep both things going by something that dear Chuck Adams taught me before he passed away, which is something that I'm not great at. And you as a writer know this. You can hone skills that you're not great at, and that's magical realism. I bring forward the characters from the 1700s into the 21st century as visions to people that have been infected. It's something I developed. It's not my first skill. Obviously, there's writers that are really phenomenal at that. Garcia Marquez. I mean, there's Tolstoy in The Brothers Karamazov. But
that's going to be great. I have read early versions of it. But it's the kind of novel I love is when you're actually learning something real, especially in a topic like this. It's fascinating stuff, and you feel like you're in good hands and learning real things as you read this fascinating tale. So, all right, on to the lightning round. Your favorite book as a kid?
Well, I'm going to say it depends what you define a kid as. I liked Holden Caulfield and Catcher in the Rye. And then as a later kid, I liked Anna Karenina, which is late high school, early college. In fact, I met my wife. My first question to her was, how old were you when you read Anna Karenina? She said 12. I was smitten. I found out later that everyone in Moscow read it at the age of 12 because that's what the Soviets wanted you to do. But that's my favorite novel.
So this is Ludmilla. Your wife is also a physician and neurologist, right?
Really great neurologist.
So how did you guys meet? Were you in...
She's a neurophysiologist, so I met her in the hospital, asking her this question.
Book or books you're reading now?
Books I'm reading now, let's see. Right now, I'm taking a pause because I'm writing. I have a thing where if I'm in the middle of writing a book, I stop reading books. Sometimes I watch series, on like Netflix or something, but I read in between writing. Now, Dr. O, by the way, used to get a pile of books, and every night he would read 20 pages and then throw the book away. And I'd say, Edgar, what are you doing? I want to see what game they're up to, he says. I want to see what game they're up to.
So do you avoid reading because you think it'll get into your own style?
Yeah, exactly. I'm on a stream. I have read so many books over my life and reread them that I push pause when I'm writing, when I'm heavily into it. As soon as I'm done with this revision of the novel, I'll go back and start reading again. How about you?
Well, I'm reading so much for research, and then I read for the show, that outside of that, it's rare that I pick up a book that doesn't have, one of those two motives behind it.
Got it.
So through the show, it's a great mix of fiction and nonfiction. But right now, I'm doing a lot of research for the next book, so it's heavily in Europe between the wars.
Great time. That's
like Weimar Germany and that sort of.
Are you influenced by Hemingway?
Yes, I love Hemingway. Yeah,
but I mean his books that were like Farewell to Arms.
Yes, yeah, I've read all those. That's a good idea. I should actually go back and reread that for a little atmosphere.
Well, The Sun Also Rises is about that period of time.
Yeah, just after the First War. Yeah. The likelihood of another pandemic in the next 20 years?
That's a hard question to answer because I would say, given the way we're letting down our force field, if you believe in Star Trek, our shields are down. But pandemics usually occur once every 100 years of the kind we just had. Mm-hmm. So it depends on how you look at the roulette wheel.
So how do we put the shields back up?
I don't like the risks of gain of function research, which is another thing my novel's about. I'm changing the name, by the way, of that novel and making it more sexy, but I'll tell you about it another time. But I don't like gain of function. That puts us in great risk that we're allowing people to manipulate viruses in the lab, and terrorists can steal those viruses. If it weren't for that, I would say no. For shields being down, meaning we're not invested enough in biodefense or in global health right now in the United States. So I think that increases the risk. People living closer together, more infections, more contagions. I think within the next 20 years, maybe something like a 20% chance, which is pretty high.
All right.
What about you?
I mean, I'm no expert. I feel like the 100-year cycle feels
real,
better to me. But so in terms of gain and function, the whole purpose of that is for biodefense. That was the hope.
But what's the sense of that when we have computers and AI? You can map all this out, in strategy. What do you need the real virus for?
Is that right? So they could get to the same benefit without actually having to create it.
I believe that, yes.
Yeah.
I think it's crazy. But, we can say ban it. How are we going to ban it in China?
Right. And so, is it actually happening still in China? I'm assuming
Of course.
all these gain-of-function
They didn't
labs
close
are
that.
still in
They didn't
business.
close that. Nobody's even been in there. How come they?
Is that so? The Wuhan lab is still business as usual.
Still chugging along.
After all of this time. Wow, I didn't know that. The craziest
I
question.
hope you'll sleep tonight, though.
I know that's like kind of nerve-wracking. But the craziest question you ever got at a book event.
The craziest question I ever got is, "Who's your ghostwriter?" I said, "Are you freaking kidding me? Are you freaking kidding me?" Anyone that says that doesn't know me,
Or
because
maybe it's a compliment, I guess.
well, I've written 5,000 op-eds in my career. I was a columnist for the LA Times. You know, I wrote a novel. With the, I mean, maybe people don't know that, but
Well, I guess
that
in their
question
defense,
floors
many
me.
of
That
the
question
books-
floors me.
Many of the books, and you're at the Fox News imprint here, which is great. I think they do like
And they
6
use
books a year or
ghostwriters.
something.
So
They
I
use
had a war
ghostwriters,
over that.
exactly.
I had a war over that. I refused
Oh,
to.
they wanted you to use one?
Well, they didn't push me, but they're like used to it. I go, well, oh, but this is a great story. So they go, well, we're not used to, but Eric Nelson knows me because I wrote a book for him before. So he knows Siegel's not going to work with a ghostwriter. So Lisa didn't know me. When I handed a few chapters in, she read them and she sends me an email that I'm going to frame. This is freaking terrific.
Who's your ghostwriter? I'm going to hire him for other
You're a
books.
great writer. Yeah.
You'll be the ghostwriter now for all of the Fox.
That I'll take
talent.
it. I'll take that job. You and me. You and me.
I'm sure O'Reilly's, back in the day, his ghostwriter was making a good sum there.
I thought that was
Dugard, right?
Yeah, I thought it was going to be you, but
No, I don't think I could take that spot.
no. But actually, O'Reilly, we're making fun. He probably writes more of his own stuff than you think.
Yeah, well, all his talking points, he used to write those all himself, and those are actually pretty good. So he's I think those were legitimately co-written. He had a partner who did a lot of the research and some of the writing, and I think Bill did a lot of the writing himself. I think
he did too. That's what he says at parties.
Most awkward or funny moment ever on air at Fox or Sirius XM?
Okay, so I was in Dubai. No, I wasn't in Dubai. I was in a place called MAHA outside of Dubai. And it was, God knows what hour it was over there. And I was on TV with Julie Banderas. And I was doing it by my Zoom or whatever the heck they use, webcast. And I had it up on a thing because you have to have the camera has to be higher than you. Mm-hmm. Your listeners don't know this. So he had it up on a thing. And it was in the middle of the night. It was, and I forgot what show it was, but the thing fell and you could see that I was wearing jeans. And Banderas says, "Nice jeans." That was the best. And that went viral. And of course, the second one's very famous is when Trump said to me, "Person, woman, man, camera, TV." That was me. And I was proud of the fact that all that happened to me was that the late night comic said, "Look at how Siegel stood there without expression, listening to this. He deserves an Emmy." And I actually think I was so impressed with Trump in that interview because he didn't use notes either. He just talks extempore, as you know. He just talks
does
extempore.
the weave, right?
Yeah.
Well, the audience should know you've got a nice pair of suit pants on, along with your suit jacket inside, not the unmatching top half, bottom half. A lot of guys, like Hannity's got a suit up top, a jeans, or something else.
Well, right.
under the
Hannity
desk
always
table.
does it. Right.
Yeah.
Hannity always never. Right. Right.
All right. In your estimation, what percentage of doctors believe in God?
It's been studied at 70 or 80%. The problem is that they separate church and state. They go from the synagogue or the church, and then they're operating, and they don't invoke it. We need to bring it in more, and we'll have less physician-assisted suicide, less cookie cutter medicine. We got to value and cherish the preciousness of each human soul. That's what this book is really emphasizing.
Do you think it's on the uptick? The amount of folks who are faithful, because it seems like faith in general is a little bit making a surge.
It's on the uptick because people are looking for something to overcome the divisiveness of our times, and that's what I'm hoping with this. That's why this book is popular so far.
Yeah, it's in pre-sales right now. It's selling like crazy, and it is a very inspiring, hopeful message. All right, so last question for Dr. Marc Siegel. One piece of advice for the audience.
Don't be rigid. And stick with old friends. I'm here with Doug Brunt, who I haven't seen in years. I have such a high regard for you, Doug, and it hasn't changed. And it's rejuvenating to be. So value your friends, value your faith, and be kind.
Feelings are mutual. It is great to be back together again. Marc, thanks so much for coming in. It's great.
Thanks for having me, Doug.